So without further ado, we'd like to introduce Dr. Joanne De Castro, our speaker. She's took up her residency in pediatrics and fellowship training in pediatric infectious disease from the Philippine Children's Medical Center. She's a board member of the PIDS of the Philippines. Currently the chairman and assistant professor of the Department of Microbiology and Parasitology, Pamantasan ng Lungsod ng Maynila, College of Medicine. She is also an associate professor of the Department of Pediatrics, the LaSalle Health Sciences Institute, College of Medicine. We give you Dr. Joanne De Castro.
I was tasked to discuss about the myths and misconceptions on vaccination. But first, the next couple of minutes, I'd like to talk a little about the vaccination, definition of terms, and we'll go on to the myths and misconceptions. So, when a child gets sick, they usually have unpleasant symptoms, which can sometimes lead to complications and unfortunately can also lead to death. Now, with this, it stimulates the immune system and therefore you produce immunity. With vaccination, this is made with the same bacteria or the viruses which causes the disease, but this time it's weakened or it's killed to make them safe. And the difference is when the child gets vaccinated, he doesn't get sick from the disease. Okay? The child's immune system will respond to the vaccine the way it would respond to the disease without getting sick. Now, this is the mechanism of action of your vaccination. Once vaccinated, you will have a primary response. And with that, you develop certain antibodies. You also develop memory cells. Now, once you are vaccinated and you get exposed to natural infection, you will have a secondary response, and that which your memory cell will also be stimulated. So mas mabilis ang response mo with the second exposure to the natural infection when you are vaccinated. Okay. Now, what's the difference between passive and active immunity? When you talk about active immunity, it's as if you make your own antibodies. You are exposed to the natural infection and you produce your own antibodies. Same way with giving your vaccine. You are given the vaccine, then you produce your antibodies, then you have your natural infection and you are actively producing your antibodies. What about your passive immunity? It's when the antibodies are actually given to you. Hindi ikaw ang magpo-produce ng antibodies mo. Sila, like your mother giving some antibodies to you when you were born. But this is not really permanent. Hindi siya permanent, no? Also, yung mga passive immunizations and immunoglobulins, like for rabies or hepatitis or tetanus, these are just temporary. You will also make your own when you're given the vaccine. But for your immunoglobulins, sila ang nagbigay sa'yo ng antibodies mo temporarily. Okay. What about live versus killed vaccines? Well, for your live vaccines, these are attenuated or weakened. This is a weakened form of the wild virus or the bacterium. And they must replicate to be effective. The immune response from your live vaccine is similar to your natural infection, and they usually produce immunity with just one dose. Sometimes, nagfe-fail. That's why you need a second dose. But once is usually enough. Okay? Except when you administer orally. So, these live vaccines can be divided into your viral and your bacterial. Viral, you have mumps, measles, rubella, varicella, yellow fever, rotavirus, intranasal influenza, and your oral polio vaccine. And for your bacterial, you have your BCG and your oral typhoid. Now, let's go to your inactivated vaccines. Unlike your live vaccines, these cannot replicate. Okay? There's less interference from circulating antibody than the live vaccines. And generally, they require about 3 to 5 doses. The first dose is usually the priming dose. That's why you need several of these before you can attain your needed antibodies. Immune response is mostly humoral, and antibody titer diminishes with time. That's why you need boosting. So some of these inactivated vaccines can be divided to whole cell vaccines or your fractional vaccines, no? So for your whole cell vaccines, for viral, you have polio, hepatitis A, rabies, and influenza. For bacterial, you have pertussis, typhoid, and cholera. For fractional vaccines, you have your subunit vaccines, and under that, you have your hepatitis B, influenza, a cellular pertussis, human papillomavirus, and your anthrax. And for your toxoid, you have your diphtheria and your tetanus. Now, what's so special about vaccines? First, it keeps the healthy people stay healthy. Okay? It not only benefits the individuals, but also as a community as well. Have you heard of herd immunity? That's the reason why you have mass vaccinations, because you want to have that herd immunity. So that when you almost immunize all of the people in the community, one or two na hindi magkakaroon ng vaccine, they can be protected. Kasi wala naman silang mahahawaan. Because almost everybody is already protected from the vaccine. So that's your herd immunity. So that gives an impact on communities, and it's more rapid. And it's also life-saving, and it's cost-saving. Okay? In fact, the US CDC, or your Centers for Disease Control, said that vaccination is at the top of its list of 10 great public health achievements of the 20th century. Okay. So, what are the vaccine benefits? The main objective of your vaccination is to be able to reduce the number of children dying from the disease, falling ill or getting sick from the disease, or being disabled. Kunyari, nag-polio, syempre madi-disable siya, no? As a result of diseases that can be prevented by vaccines. Diseases are becoming rare because of vaccinations. Have you heard of smallpox? Wala na. Eradicated. Okay? Keep immunizing until the disease is eliminated. That is our goal. Okay? And we vaccinate to protect our future. Now, before we can go on to looking at the benefits, no, from the vaccines, let's go back. Before, when there were no vaccines, like in 1952, polio paralyzed more than 21,000 people. Nakakita ba kayo nito? Ako hindi. But this is the iron lung machine. Siguro mga lolo natin nakakita ng ganyan. But nowadays, wala na. Before 1985, Haemophilus influenza type B caused serious infections in 20,000 children a year. And in 1964 to 1965, there were 12.5 million cases of German measles. So that's a lot. That was before the vaccines came in. Also, in 1920s, look at this child. This is suffering from what? Difficulty of breathing. Why? This child has diphtheria. So ilan yon? 100,000 to 200,000 cases and 13 to 15,000 deaths each year before the advent of the vaccines. And look at this one. More than 1 million cases of pertussis. Before the advent of mass vaccination, okay, there were so many children suffering from severe cough, no? Severe cough, yung mga fits of coughs, because of pertussis. Now, in terms of the vaccines, well, it all started in 1798 when they discovered smallpox. The problem is they don't know what it does, no? So for the next couple of years, like 80 years, wala silang ginawa kasi hindi nila alam kung anong gagawin nila. So eventually, after mga 80 years, they came up with the rabies vaccine. And through the years, they came up with these vaccines which somehow decrease the incidence of all of these diseases. So these are all vaccine preventable. For smallpox, okay, before eradication, the fatality rate was close to 10%. But now, see, it has been officially declared eradicated December 1979. And that's good news. And hopefully, maybe polio, like measles, that will be eradicated soon. Now, to show you the impact of the vaccines on infectious disease rates, in the early part of 20th century, tingnan mo yung diphtheria, there were 175,000. In 2003, isa na lang. That's because of vaccination. Mumps, 152 plus. Now, 231. Actually, not now. It's 2003. For pertussis, 147,000, now down to 11. Polio, 0. Rubella, 7. Congenital rubella syndrome, 1. And for Haemophilus, a little less than 300. That's good news. Okay. So as I said early on, it also benefits not just individuals but the society as well, and of course yung economic benefits niya. Okay? So thanks to immunization, there are 27 vaccine preventable diseases which prevented 3 million deaths, no? Saved from disability 750,000 children. And supposedly, those immunized children had significantly higher scores in IQ, no? Language and math. Okay, we talked about herd immunity. So even if you don't get to immunize 100%, maybe 90% or 80%, that's also good. Because when you almost vaccinate everybody, then you also protect those who are not vaccinated. Okay? So this can contribute to social and economic development. Why? Because when they're vaccinated, they become healthy, you decrease hospitalizations, decrease the need for expensive treatments, no? Decrease the loss of productivity, decrease permanent disabilities, reduce the disease outbreaks, and limit long-term effect of the diseases. Okay, so for economic benefits, it will be different in the developing world and in the developing world. In the sense that, with the exception of clean drinking water, vaccines are the most cost-effective intervention for economic development here in the developing world. That includes the Philippines. And in fact, there's a 10-year gain in life expectancy, which translates into nearly additional 1% of annual growth of income per capita. It's like parang pag marami kang anak, mas marami magko-contribute. Marami kang anak na healthy. Kasi kung may sakit, burden din minsan. Okay? Now, in the developed world, for each birth cohort vaccinated, it saves the US, like 10 billion in direct medical cost and 33 billion in direct cost. Okay. Just to show you a good example, for hepatitis B vaccination, if you get 3 doses, you just pay like $320 US. But if you don't get vaccinated and you get hospitalized, you pay at least $8,000. That's a lot compared to your just $320. Or hospitalization with cirrhosis, which is like $14,000 US. This $40,000 for treatment of chronic hepatitis B for 2 years. And if you undergo liver transplantation, which translates to millions in our country, compare that to when you just have to pay for 3 doses of like $320, that's a lot, diba? So, might as well get vaccinated. Now, there's a drawback. Why is there a drawback with the success of vaccinations? Because sometimes we become complacent. Sabihin mo, oh, wala na naman eh, so let's stop vaccinating. Diga? No more eh, so let's stop. No? And then you have these anti-vaccine stories. Have you heard of those? Dami. So, the problem of your misinformation is that there are myths and misinformation about vaccine safety. And this can actually confuse parents, no? They're trying to make sound decisions about their children's healthcare. And then here comes this sa TV na, oh, this is not good. The MMR can cause autism. And the child is just due for MMR. So what will, I don't like my child to have autism. So I will not have the child vaccinated. That's bad. Vaccination is also common, no? It's a memorable event. And association events in time often signals cause and effect. Now, while some of the sickness or reactions that follow vaccination may be caused by the vaccine, many are unrelated events that occur by coincidence after vaccination. Baka naman before that, na-expose na siya, no? And then the parent did just say na, oh, we ate something or was exposed to somebody, no? Nagkataon lang. Therefore, the scientific research that attempts to distinguish true vaccine adverse events from unrelated chance occurrence is really important. So you need to have very good history before you do your vaccination. Okay, now let's go to the misconceptions. Meron kang patients, myths, and misconceptions. Number 1, vaccines cause many harmful side effects, illnesses, and even death, not to mention possible long-term effects we don't even know about. what's the truth? There will be some mild reactions. And these mild reactions are really expected. So what are these? There's tenderness, redness or swelling where the shot is given. That's common. Mild fever, they can happen in one child out of 4. Hindi lahat, merong iba. Okay? And they appear soon after the shot is given, and they can go away within 1 to 2 days. You just have to tell them that, oh, your child might get sick for maybe 1 to 2 days, and then he will be fine. You just have to tell them that. There have been cases of severe infections or reactions, but this happens much less often than the mild form. So they can have severe allergic reactions due to a substance in the vaccine, and getting a disease is much more likely to harm a child than getting a vaccine. Yung kanina pinakita ko sa inyo. Okay, risk from the disease versus risk from vaccines. Tingnan natin. If the child gets sick from measles, these are some of the complications. Pneumonia, encephalitis, death. If they receive the vaccine, the MMR, sometimes they have severe allergic reaction or they can even have encephalitis. But this is 1 in 1 million. Whereas if you get sick, that's 1 out of 2,000. Okay? What about for mumps? Well, you can have encephalitis if you get mumps. Or rubella, you can have congenital rubella syndrome if the womb becomes infected early in the first trimester. Or diphtheria, tetanus, and pertussis, they can die from that. What about when you have DPT? Well, some of the reactions that can be seen, very uncommon, is continuous crying, but they can fully recover. Convulsions or shock, then fully recover. Acute encephalopathy, there were no deaths from vaccinating, from DPT. Okay, giving an infant multiple vaccines can overwhelm the immune system. You know, when you're born, you're already exposed to several of these organisms. It will not kill you, okay? So vaccines use only a tiny proportion of a baby's immune system's ability to respond, okay? Healthy babies constantly make antibodies against these bacteria and viruses. And smallpox vaccine. Let's talk about the smallpox vaccine. That was the first one, and it contains 200 proteins. Now that we have like 27 vaccines, it only contains 130 immunologic components, much less than the one vaccine that we had before. So konti na. Some vaccines cause autism in children. Oh, this was really big news sa atin about Dr. Wakefield. He was a British doctor, and he made claims about connecting autism with the MMR. But 10 years later, they retracted it, the Lancet journal. Okay? So this was the one that was retracted, yung autism and MMR vaccine. Ginawa niya ng story yan. There was no truth to what he claimed, like in 1998. Okay? The other one is thimerosal, causing autism. The form of mercury, which is found in your thimerosal, is ethyl mercury. And it's not methyl mercury. So what's the difference? Methyl mercury, ethyl mercury. Kasi, yung methyl mercury, ito yung form that has been shown to damage the nervous system. Not the ethyl mercury. It's the methyl mercury. In fact, yung sa mga fish, may mercury yan. Mas maraming mercury dun sa fish that we eat. Okay? Multiple studies have shown that thimerosal in vaccines does not cause autism. When comparing children who receive thimerosal-containing vaccines and those who receive vaccines not containing thimerosal. But because of this one, sige, ginawa nila, they removed na lang the thimerosal-containing vaccines. Okay? Formaldehyde, they are used to detoxify diphtheria and tetanus toxins or to inactivate the virus. The tiny amount which is left over from these steps in making vaccines is actually safe. Okay? Humans normally have formaldehyde in their bloodstreams at levels higher than is found in the vaccines. And for miscellaneous, antibiotics are present in some vaccines because in some cases you have multi-dosing. So to prevent that contamination, they incorporated some antibiotics, And the other one is additives like your gelatin, albumin, sucrose, lactose, and glycine help the vaccine stay effective while being stored. And it's still safe. Pneumococcal vaccine. the pneumococcal polysaccharide vaccine is not effective. This is a myth. Why? Because the pneumococcal infections claim an estimated 1.6 million lives worldwide each year. Now, with the introduction of your PPV, okay, it has demonstrated over age groups and periods of time since vaccination that it is effective. Now, the PPV or your pneumococcal polysaccharide vaccine will not work for children who are less than 2. That's why you have the pneumococcal conjugate vaccine for it to work on that specific age group. Now, the influenza vaccines are also not effective. There are at least 2 factors why it's not effective. Characteristics of the person being vaccinated, like the age and the health, baka naman hindi siya tama dun sa age, no? And sometimes there's a mismatch. Sometimes, the way they do the vaccine is they wait for kunyari kung ano yung lumabas ngayon, yun yung magpe-prevail na gagamitin nila for next year. But sometimes there's a mismatch. So when that happens, it's not really that it did not work, kaya lang kulang yung laman ng vaccine. Okay? Diseases had already begun to disappear before vaccines were introduced because of better hygiene and sanitation. Well, there have been instances where it can be prevented. However, let's just talk about the rotavirus, no? Ang rotavirus mo is present in both developing countries and developed countries. What's the difference between your developing and developed? Clean ang developed. Not so clean ang developing countries. But still, if you look at the data, it's the same. Rotavirus for the developing and developed. So, when you talk about the hygiene, it's not the end all and be all. You also need the vaccines. See? So the actual incidence of disease over the years can leave little doubt of the significant direct impact of the vaccines. See, smallpox eradicated, polio it has dropped by 99%, measles, okay, dramatic reductions. I was asking my students, have you seen measles nowadays? None. Sabi ko, oh, okay. DPT, dramatic reductions, and HIV, reduced incidence in Europe by over 90%. Why? Because of these vaccinations. Okay, vaccine hesitancy. Well, an estimated 1.5 million children still die each year of diseases that could be prevented by vaccines that already exist. Vaccine hesitancy refers to delay in acceptance or refusal of safe vaccines despite availability of vaccination services. Probably because of the myths, yung mga haka-haka, kuro-kuro, yung mga chismis, no? There's hesitancy because they believe in those things. Factors contributing to vaccine hesitancy, concerns about vaccine safety, negative beliefs based on myths. Vaccination of women leads to infertility. There's misinformation and mistrust in the healthcare professional or healthcare system. This one, yung vaccination of women leads to infertility. I think there's something to do with yung mga tetanus, no? So for a time, marami nagtetanus noon na babies. Okay. So these are some of the strategies for addressing vaccine hesitancy. But I think the more important one is that for us healthcare professionals, we need to encourage patients to increase their knowledge of vaccines and vaccine safety, and we must be approachable so that they can ask us, no? And we must be sensitive on the matter. You don't dismiss them. You address their concerns. That's it. Okay? These are your misconceptions, provider myths and misconceptions. There's a limit to the number of vaccines that can be given at the same time. No. You can give anything and everything all at the same time. There's no upper limit. No? There's no upper limit established regarding the number of vaccines that can be administered in one visit. That happens when somebody's going abroad. I need vaccines, and then you count them. Oh, there are 16. Can you give all? Yes. The ACIP recommends administration of all recommended vaccines at the same time. Vaccines can't be given to people who are sick. You have to qualify kung ano yung sick sa kanila. Mild acute illness with or without fever is not a contraindication to vaccination. I often hear that, oh, hindi po binakunahan sa ano, because may sipon ubo. What else? Fever? No. Okay, so you can vaccinate. Okay? Neither is antibiotic treatment recent exposure to an infectious disease or convalescing from an illness. That's not a contraindication for vaccination. Now, these are also invalid contraindications to vaccination. Mild illness, antibiotic therapy, pregnant or immunosuppressed person in the household, breastfeeding, preterm birth, allergic to products not present in vaccine or allergy that is not anaphylactic. So, kunyari nag-allergies, pero kung mga nangangati-gati lang, that's not a contraindication. Kasi meron mga measles, kasi meron siyang egg. So, baka sabihin, oh, this child's allergic to egg. Can I receive it? Well, it depends. Kung yung allergy niya, anaphylactic shock ba, then don't give. But kung nyali parang mga pula-pula lang, you can. Family history of adverse events, tuberculosis skin test, multiple vaccines, those are invalid contraindications. You can give vaccinations with all those symptoms. Certain vaccines can't be given together. Okay. All routine vaccines can be given simultaneously at the same time, not in the same syringe. Okay? Just remember that. Not in the same syringe. If 2 live viruses vaccines are not given at the same visit, you should wait for at least 1 month. Okay? So, one vaccine, kunyari, measles, mumps, rubella, and then nakalimutan mo mabigay ng varicella. So, you need to give another live vaccine, wait for 1 month, 4 weeks. Okay? But, kunyari, live vaccines, tapos you need to give an inactivated vaccine, you can give tomorrow or this afternoon. So, walang kinalaman yon. Just live vaccines, okay? Inactivated vaccines can be given at the same time or at any time before or after another inactivated or live vaccine. Ito, tips. Always read the package labels to avoid vaccine administration errors. Sometimes you use the wrong diluent, sometimes wrong formulation, and sometimes it's expired already. Do not give expired vaccines, please. Do not deviate from recommended route of administration. If it's sub-Q, you give sub-Q. Or IM, you give IM. Okay? Never mix vaccines in the same syringe unless they are specifically approved for mixing by the FDA. Baka ito naubusan, so you get one and then you just combine. Do not do that, please. Record vaccine and administration information, including lot numbers and injection sites in the patient's record. It is hard to do. What I do is I take out from the box and then I paste it doon sa ano. So that way, I'm sure that that's the vaccine that I gave. And you will also see that it's not expired. So this is just the natural history of vaccination program. So before vaccination, you see that the disease here is high. But once you start vaccinating, okay, the disease goes down. So this is when you start vaccination. So the disease goes down. But at some point, it levels down. So parang naging complacent ka. So you stop vaccinating. And that's a time that there now becomes an epidemic. So once you have the epidemic, oops, I need to vaccinate again. So you need to vaccinate. You revive the confidence. And then hopefully eradicate the disease. So vaccines, with the exception of safe water, no other modality, not even antibiotics, has had such a major impact or effect on mortality reduction. So with that, I think this is the last. Thank you very much for listening.